Good afternoon, everyone, and thank you for joining us for the 20th anniversary of the Women's Forum for Health, Advancing Health, Hope, and Resilience. I'm Drea Blackwell, the sports anchor at KSBW, and as you can see, we are in our beautiful studio. So honored, so excited to be here with you today, joining as the MC and the moderator for this event. For the next hour, we will be celebrating 20 years of impact through the Women's Forum for Health and hearing from a panel of Montage Health medical leaders on what it's been like caring for our community during the coronavirus pandemic. We'll end our time with a special musical performance from local musician and coronavirus survivor Andy Weiss and his bandmate Gary Meek. To kick things off, we'll start with a brief video on the forum's impact.
The Women's Forum for Health was started by a small but mighty group to shine a light on health issues women and families face every day. Over 2 decades, philanthropic leaders and community changemakers have come together to enhance awareness of critical health topics. Together, we have raised more than $1.1 million, supporting a wide array of health initiatives for women and families in our community. Our impacts reach across heart health, nursing training for elder care, newborn care, pediatric wellness and diabetes prevention, free or low-cost mammograms, and a new breast care center. 20 years, countless impacts. Thank you for being a part of Women's Forum for Health.
Wow, what a terrific piece that was. I absolutely love the work of our video team. Thank you guys so much for telling such a great story. I'm Kevin Causey. I am the Vice President and Chief Development Officer, and I run the Montage Health Foundation.
And I'm Michelle Militia Young, Director of Montage Health Foundation. It's so amazing to see how much the Women's Forum for Health has accomplished over the last 2 decades. Kevin and I are honored to be part of the great work like this event to strengthen the health of our community.
We are so grateful for the support of all of you who've been involved with the Women's Forum for Health for so many years. It's so great to see all of you here again this year. And for those of you for whom this is the first time you've been with us, welcome. It's great to have you. The one upshot from having a COVID-related event in this kind of a format is that we can invite everybody from all over the place. And we can have a lot more people here today than we have when we did these things live. So I'm told that there are people from all over the country and even all over the world who are tuning in. Thank you so much for being here today.
The Women's Forum for Health wouldn't be the special gathering it is today without the support of change makers and philanthropic leaders in our community who have invested their time, resources, and attention towards improving community health. In partnership with Montage Health Foundation, we want to especially thank this year's sponsors who are making an impact supporting Montage Health Foundation's COVID-19 Response and Relief Fund. We feel so fortunate that we did not see any decline in sponsorships for the event this year, even with all the challenges in the world and needing to take our event virtual. It's really a testament to the commitment of our supporters to advancing health, hope, and resilience for our community in good times and in tough ones.
The theme for our sponsorship levels are tied to values that have always been embedded in the work of the Women's Forum for Health and are really important to our communities now more than ever. So I want to start by thanking each and every one of you, but especially our resilient sponsors, Nancy Dobbins and the Dobbins Family Foundation, Jane McCoy, and Joanne Storkin of Honest Engine Films. I want to thank our host sponsors, Lori Benjamin and Sharon Marisman. And I especially want to give a shout out to our Unity sponsor, Bertie Violet Elliott. And for all of you who are sponsors at the kindness, compassion, and empathy levels, thank you, thank you, thank you. There's no way that we can do the work that we do year in and year out without the support of people like you. And for that, we are really grateful.
This event also wouldn't be possible without the support from our Women's Forum for Health Committee, whose members support the foundation with our planning each year. So now we'd like to turn things over to this year's committee co-chairs, Nancy Dobbins and Penny Morris, to share some exciting updates on the impact already underway, thanks to many of you over the last few years.
Thank you, Kevin and Michelle, for your introduction. Good afternoon, everyone, and thank you for joining us. Today, we are delighted to be celebrating the 20th anniversary of the Women's Forum for Health. It is amazing how one luncheon with a small group of women has evolved over the years and accomplished so much. We are pleased to share with you today a special update on the Carol Hatton Breast Care Center, which the Forum raised funds to support in both 2018 and 2019.
If all goes as planned, the new center will be completed in January of 2021 and will open its doors to all of us in February. The new facility will be double the size of the current breast care center, which will increase the availability of diagnostic imaging appointments for all the women in Monterey County. We will all benefit from the latest technology, which will include 3 new 3D mammography machines. Over the past 2 years, the Women's Forum for Health has raised over $400,000 for the purchase of new ultrasound and biopsy tables. In just a few short months, this will all be available to ensure that the women in Monterey County receive the very best care they can get.
This is just the latest development in a 20-year history through the Forum and its supporters. The Women's Forum for Health Committee that we co-chair is composed of a dynamic group of women who are passionate about improving community health. We want to take a moment to recognize and thank our fellow committee members for all that they do. Since we can't invite everyone up on a stage this year, I'd like to ask each of them to wave from their homes and to recognize and give them our sincere thanks and appreciation.
As you know, this year our donations to the Women's Forum for Health will support Montage Health Foundation's COVID-19 Response and Relief Fund. Your gift will provide critical resources and much needed support for healthcare workers and patients. We will now show a brief video to explain more about the fund and its impact.
For 8 months, we have fought COVID-19 with your help. Hundreds of community members have contributed to our COVID-19 Response and Relief Fund, providing critical support. Though progress is being made on a vaccine, the end of this pandemic is not in sight. Your continued support is needed, now more than ever, for protective gear, medical supplies, and cutting-edge tools. Together, with your help, we can advance health, hope, and resilience for our community.
Hi everyone, I'm Sharon Marisman, board member for Montage Health Foundation and longtime attendee and supporter of the Women's Forum for Health. We are so grateful for the outpouring of support we've received from the community. For those of you who have already made a gift to our COVID-19 fund, thank you so very much. It is incredibly meaningful and uplifting to know that the community stands by our healthcare team and patients during these challenging times. And please keep a lookout for your name on our scrolling list of supporters on the event webpage.
The gifts we've received thus far for our COVID-19 fund over the last 7 months have totaled over $2 million and are already making a huge impact in our work tied to this pandemic. One example, and it was noted in the video you saw a few minutes earlier, was the Moonbeam medical device that we purchased right at the beginning of the pandemic. Its job is to take ultraviolet rays and disinfect used masks. So as you all well know, N95, KN95 masks of all kinds, were in very short supply. So this allowed us to be able to revitalize, resuscitate, reuse masks here in the system. To date, we've done that 1,700 times. So you can imagine the impact that that's had on our frontline workers. Look, Like the video said, the pandemic is far from over. We don't even know what the pandemic is going to be looking like and how it's going to ebb and flow and how it's going to impact our communities. You can make a gift today. You can make a gift later. For those of you who are watching live, I ask that you think about doing it today. For those of you who are watching a broadcast of this event later, I ask that you do it when you're watching it. Every nickel you give us, every nickel, I promise you, is going directly to the work of our frontline workers. It's supporting our patients, it's supporting our healthcare workers, it's supporting our staff who are parking the cars, who are as exposed as anybody else in this whole system. So I ask that you help us today for the inevitability of some surprises that are coming down the pike. And there are two ways to do it. You can click donate at the top of the screen that you're looking at now, or you can text Montage, M-O-N-T-A-G-E, Montage, to 91999. Two easy ways to do it. There is no such thing as a small gift to us now in this time to tackle this problem. I hope you'll consider it, and thanks so much for even hearing me out.
Thank you again for your continued support to advance health, hope, and resilience for our community. Now let's get started for the main part of our program. Over to you, Drea.
Thank you to Kevin and Sharon, and hello again to everyone joining us. I am so excited to get started with our panel discussion with three of the amazing healthcare professionals who are caring for our community in really a variety of ways. So I want to introduce them to you now. We have Dr. Martha Blum. She is the Medical Director of Infection Prevention at Community Hospital of the Monterey Peninsula, and she has been a leader in Montage Health's pandemic preparation and response efforts. Next, we have Dr. Melissa Hart. Dr. Hart has treated COVID-19 patients at Community Hospital as a hospitalist. That's a doctor who really specializes in caring for hospitalized patients. And finally, I would like to introduce you to Dr. Kaylin Erickson-Moreo. She is a licensed clinical psychologist who specializes in neuropsychological assessment. She has helped to treat people as they navigate the pandemic and all of its different impacts. So thank you all for being here and for all that you do to serve our community. We're very interested to hear your insights, your experiences working through this pandemic. And with that, I'd like to ask you some questions about how that has been. Starting with Dr. Blum. As someone who's had a career, in researching and treating infectious diseases, what has it been like dealing with a disease that by its own name is novel and that seems to be constantly evolving?
Yeah, that's a great question. And I have to say, it's never been a better time to be a person with a medical and PhD degree in medical virology. So that definitely gave me a good background for having something to draw on to understand a new virus. And pick your favorite analogy, but we're definitely learning as we go, not just the professionals, but the whole world, really. So it's been a very interesting situation where we're every day learning from the scientists and having to put that immediately into clinical practice. We've never done anything quite like that before. And at the same time, my background as a professor and a teacher has really come in handy because we're teaching science and health to everyone in our community as we're learning it. So that's been a real challenge. And, often it's a university level education that we have to bring down and explain to everyone in the community. But quite honestly, one of the biggest challenges with dealing something that's so novel is dealing with the uncertainty. There's so many questions and so many times the answer is, we just don't know. And that can obviously produce a lot of fear and anxiety in the people that we're trying to protect and trying to educate them for how to prepare and protect themselves. But oftentimes people deal very differently with change, with uncertainty, with ambiguity. And again, that fear and anxiety can often be our worst enemy. So with something so new, that's been quite the challenge. We're always dealing as an organization with new things that are being thrown at us. And I have to say, it's been a real pleasure working with everyone in the Montage Health enterprise because as crazy and as new as this is, everybody has been just there to quickly implement as soon as we possibly can all the right things that we know how to protect and care for people who do get infected.
Thank you. And we're definitely going to hit on those stressors, the fear, the anxiety. That'll be coming up a little bit later in our panel discussion. Dr. Hart, I have a question for you now. As a hospitalist, you work on the front lines directly treating COVID-19 patients as part of your daily work. So can you describe what that has been like both clinically and emotionally to treat patients with COVID-19? How is it for you and how is it for the patients?
So I don't think I have to say this, but the pandemic emotionally has had a huge toll on everyone, including our patients. So many months ago, early on, I was actually involved in the care of our first patient to die of COVID-19. And the isolation, the necessary precautions made it so that no visitation, communication was isolated to kind of occasional virtual interactions. And then that lack of bedside family comfort at time of death just seemed almost cruel. And we still do, we feel helpless. For patients, the frequent questioning of whether they were going to make it kind of further reflected that fear, that unpredictability of COVID, and that physical absence of family and friends left patients feeling alone, disconnected, and despite all our efforts with regular updates to family, there's only so much you can do. I think the isolation was certainly felt. So kind of the practice of medicine for me is all about that connection, the collaboration with nurses, consultants, that bedside time, learning about these patients of ours as individual people. And pandemic has just ripped that away. I mean, that's totally gone. We became hidden behind our masks, our goggles, minimizing our interactions in places where we used to gather to discuss patient care. So emotionally, I'm anxious, fearful, and above all else, I grieve. I grieve that loss of connection that I value hugely.
Thank you, Dr. Hart. And Dr. Erickson Murillo, I think you can sort of speak more to that. You've helped people work through a lot of that emotional stress that comes with the pandemic, the fear, and it's truly a scary situation for anyone, a patient or somebody in the outside world. So when you and your patient are both wearing masks and your facial expressions are limited, you're trying to connect with this person, how do you go about building that relationship and bringing humanity to those interactions when people need it the most?
So we quickly pivoted here from in-person visits to virtual visits, which were wonderful for not having to be, in the same room and face-to-face with someone. But it's harder to pick up on some of the nonverbal communication pieces of things with the virtual visits. So for those, I would be very upfront with people that we would probably experience some kind of technical issue and that we would work through those as they arise. We had a technical issue when we were all trying to get on here today, so they are quite frequent. And I also let patients know that we may talk over each other and that that's okay. That's not me being rude or them being rude. It's just kind of how it goes because a little bit of the nonverbal gets lost in those virtual visits. And I would tell patients to pipe up when they have questions. Don't save them for the end, but bring up any questions that they have as they think of them or as they come up, because I don't want them to be, holding on to a question that they want to ask me throughout the initial visit with them and not be able to focus on other important things. As far as in-person visits go, it's true, seeing people from here down, part of the questions that I ask people who are having memory problems is if they have difficulty recognizing people's faces. And so I've been trying to interject a little bit of appropriate humor into interactions with patients. And, when I ask them that question, I say, you can only see this part of people these days. Have any difficulty recognizing people's eyes? And I find that humor in particular can be a real humanizer. And when I'm able to have a really good, genuine laugh with a patient, a belly laugh, it's almost a release to be able to laugh with someone in current circumstances. And it also makes the interaction more genuine and personable.
Awesome. And I couldn't agree with you more on the laughing part. I think we all could use that right about now. Few and far between, we need them. Dr. Blum, I want to come back to you. I have sort of a historical question to come with you. Some have compared this pandemic to the 1918 flu, the Spanish flu, more commonly known, and that's considered the worst global pandemic of the 20th century. So what do you think the outlook is for COVID-19 and potentially other diseases like it going forward? Is this something that's a 1 in 100 years type of phenomenon, or is it something that in our lifetime or maybe in our children's lifetimes, we will see this happen again?
Yeah, unfortunately, the coronavirus COVID-19 pandemic, it's not the first pandemic and it won't be the last. And we're not even sure how long this one will continue to go on. But even in our lifetimes, I think most people would remember HIV. HIV became a global pandemic in the 1980s. And then more recently, we had another global pandemic in 2009 with, again, influenza, with H1N1. So I think what they demonstrate is that these types of viruses are constantly emerging, but they don't always turn into pandemics. For example, with HIV, it's estimated that that virus that caused AIDS had transmitted from animals to humans perhaps 3 times before it actually turned into a pandemic. And same thing, we see intermittently transmitted viruses between animals and humans, but they hadn't always turned into a pandemic. The difference is our new world, our new modern or postmodern world, however you want to characterize it. So the way that we travel, the way that we interact, the way that we unfortunately conduct modern warfare and have international trade, and just our own human desire to explore new and different places or new and different foods. All of these can contribute to viruses being introduced into humans for the first time. So unfortunately, we've seen it before and we'll see it again. But I am very hopeful that the lessons that we're learning now will be applied to any future incidents where we start to see perhaps there was some suggestion that there was a new or different virus. I'm sure we're already starting to reflect on the events of last December and January as, opportunities missed. And I'm really very hopeful that when we reflect, we'll say, okay, we won't let that happen again, that we will take these lessons to heart. And the next time a threat like this emerges, there won't be any hesitation to do what we need to do.
Thank you, Dr. Blum. Essential workers, like healthcare workers, who I'm speaking with right now, are one of the groups most likely to experience traumatic stress, mental health challenges as a result of this pandemic. And Dr. Hart, I'd like to ask you, what are some of the most common stressors that you have heard about from colleagues during this pandemic?
Interestingly, the stressors with respect to the time since the onset of this pandemic have been quite varied. They've ranged from the stress of the fear of getting the virus and bringing that home to one's loved ones and families, to increased isolation from neighbors, community, churches, and other people that you would usually lean on in your day-to-day life. Some people had loss of financial security, with canceling of surgeries. They worked less shifts. They had young kids at home and therefore weren't able to work without care of those kids. And even now, kids are at home, they're not in school, and that ongoing stress of needing to find care for their kids is certainly takes a huge toll on everybody. And then I think the connection, I think that's a big part of what was lost at work. We don't have any meetings anymore, gatherings, and then everyone loves a good old potluck, and those have all, they're all off the table as well. And then the loss of touch. I think the hugs, the physical comforts that we all sometimes need to know that it's all going to be okay. I think that too has been a huge, huge stressor for everybody.
Thank you, Dr. Hart. And to hit on that a little bit more, we're all actively trying to avoid getting the coronavirus, but all of us, regardless of contracting the disease or not, are impacted somehow. So Dr. Erickson-Moreo, what do you think the long-term mental and emotional impacts of this pandemic will be, and what advice, this is a big question, what advice could you maybe give our attendees today to mitigate those types of impacts, those emotional, those mental impacts?
You're right, it is a big question, but I am really happy to have this opportunity to talk about psychological first aid as the what to do. So just like we have medical first aid to help treat smaller, cuts and scrapes and bruises and other and burns, other smaller medical conditions, the concept of psychological first aid is having practical, real-world things that everybody can do in their daily life to help foster a sense of psychological well-being and resilience. So I'm going to run through a few of the points of psychological first aid and maybe talk about a few resources that I like to help our audience to be good practitioners of psychological first aid. So the first step is to address basic bodily needs first. This includes ourselves, but also the community, your community. But yourself first in this case, right? Just like when you're on an airplane and they say put on your own oxygen mask before you help those around you. You need to address your basic daily bodily needs, food and shelter and clothing and love, all of those things. I really like the COVID Coach app. It was developed by the Veterans Administration, a whole team there, but it has a really nice resource guide to help for people who are having more difficulty with those basic daily bodily needs. It has a resource guide as well as some tools to manage stress and to check in with your mood, all in one kind of handy dandy resource on your smartphone. The second step in psychological first aid is to avoid future harm. And this involves a lot of practicing compassion and gratitude with yourself and others. I am really trying to practice what I preach. And when I talk to my patients about gratitude, it doesn't have to be a huge thing. When the first day after all of the wildfires, when the sky was blue and the clouds were white and puffy and the air quality index was below 50, I got out of my car in the morning and said, okay, I'm going to really try and practice gratitude for this nice piece of blue sky. Avoiding future harm may also entail setting limits on media consumption. So we as humans want to know the most updated information, especially about COVID, but too much information overload may cause dips to mood or cause anxiety to ratchet up and peak. And so it may involve setting a limit of how much you're going to check headlines, and also to narrow down the sources, the reputable sources that you're getting media consumption from. The third step is deemed keep calm to carry on. Although sometimes I feel like talking about mindfulness is a bit of a Band-Aid. We are talking about psychological first aid, and Band-Aids are part of a first aid kit. So this is where mindfulness comes into play. Mindfulness has decades of research on its effectiveness for anxiety. Anxiety really at its core is anything that takes us out of the present moment and has us either thinking about all of the bad things that maybe could happen in the future and coming up with contingency plans and worrying about things that haven't yet happened and may never happen, or replaying things that didn't go well in the past over and over and over and feeling a sense of guilt or shame or doubt based on past things that we have no control over now in the present moment. Mindfulness is anything that brings you back to that present moment and keeps you focused there. There are lots of really nice free resources for mindfulness. I personally like the apps Buddhify and UCLA Mindful. I like the website mindful.org, and Chomp is right now currently in the middle of offering a free online everyday mindfulness class every Monday night.
Thank you. I felt like I should be taking notes during that, like how to get over
anxiety I have. Again, I would think.
It's so relatable. Everybody is going through this to one degree or another. So thank you for that. That's very helpful and useful for everybody that's trying to get through this. Next, we have the lightning round, which sounds really intimidating, but I promise you it is not. It's going to be easy. I'm going to ask you all the same question to all three of you, and then you each will have about 30 seconds or less to give us an answer. So I'll tell you the order we're going to go in now. We're going to go with Dr. Hart, then Dr. Erickson Moreo, and then Dr. Blum. So the lightning round question is, what is the most important thing each of our viewers at home can do to help our community work together against COVID-19 going forward?
So even though I'm going first, I'm going to say that do what Dr. Blum says, okay, first and foremost, but also through personal experience, reaching out, help your neighbors, bring communities together, simple acts of kindness, simple acts of just reaching out for the occasional check-in, and engaging your kids to do the same, to just attempt to bring some connection during this isolating and very disconnecting time. And just remember, we're all in this together. It may not seem like it at times, but we are.
I would say help others where you can, ask for and accept help where you need it, and echoing Dr. Hart, remind yourself that we are all in this together, because research into prior pandemics, Ebola, for example, tells us that altruism, kindness for kindness's own sake or for the sake of others and not ourselves, has really been what has made past quarantines more tolerable.
So I'm going to go with the obvious answers, which is wear a face covering, keep your distance from people who don't live in your household, keep your gatherings to small groups, meet outdoors as much as possible instead of indoors, clean your hands as frequently as possible, and get a flu shot this year. It's more important this year than ever that you avoid getting the flu. And I want to just follow that up with be a good role model, be a positive influence. Take these bits of advice and spread them to your friends and neighbors and set a good example. We mentioned it before. People are getting very fatigued. They want to know when this is going to be over. They want to know when things are going to go back to normal. But the more that we can set a good example and continue to do these things and make it expected that these are the things you do because you're a good friend and neighbor, it'll be just that positive reinforcement that we all need to get through it, because we all just need to be there for each other.
And I like Dr. Hart's slogan, just remember that, listen to Dr. Blum. We'll just put that. There's the advice, everybody. Thank you all. You've made it through the lightning round. I told you it wasn't going to be that bad. And thank you so much for sharing your time, sharing your expertise, your insights with the community. For those of you watching at home, take the advice from these doctors and let's do our part to keep our community healthy. If you would like to learn more about the number of COVID-19 cases in Monterey County or any tips on what you can do to stay healthy, please be sure to look at the resources shared on the Women's Forum for Health webpage. There's a link below if you would like to check that out, or you can visit chomp.org, chomp.org. And I want to leave you all on a positive note today, and to do that, we will end our program with an inspiring musical performance by local musicians Andy Weiss and Gary Meek. And what makes this performance so special is that just a few months ago, Andy was incredibly sick with the coronavirus. He was fighting for his life in the intensive care unit at Community Hospital, and today he's still working on his recovery, but he is well enough to do what he loves most and to play his music for us today. Before they perform, though, I would like to welcome in the nursing director of the intensive care unit at Community Hospital, Sonia Abeda, to share a little bit more on Andy's story.
My name is Sonia Abeda. I'm the director of the intensive care unit here at Community Hospital. Andy was with us for 25 days, including 8 days on the ventilator. He was critically ill, and to see him be able to turn that around, I attribute to the staff and his determination to get better. We're here for the patient. We're here to provide care to them when they're most vulnerable. It is a wonderful thing, a wonderful feeling to be able to take care of our community. Your support helps us remain resilient during these times when you need us the most. No matter what, we're here for you.
I sure feel loved, I'll tell you that. Andy Weiss.
you.